And just a warning, if it does die in the middle of it, I'll just ask you to stop and we'll reconvene.
No, can you keep doing your presentation if the camera stops?
Okay.
Hi, Adrianna Ace.
Hi, Dr. Ashley Payne, how are you?
Good, nice to meet you.
Good.
Can I have a seat?
Yes, please.
Here is my business card. That
Thank
way you have a way to contact me after this.
Perfect.
All my information on there.
Appreciate it.
So how are you doing?
I'm doing really good. Had a early morning. I got up at like 3 o'clock, so it's great.
Good. Did you have a good weekend?
I did. It was good, super easy.
Good weather.
Yes,
It was perfect.
it was perfect.
You enjoying the warmer weather? Or
I
is it
love the
cold?
warmer weather. I do not like the cold.
Me too.
No.
So tell me, whenever a new device or product hits the market, are you quick to jump on that, or do you prefer to stick to what you have?
No, I'm really open to trying new things because, saving lives with all that, you gotta have the best and newest things to make sure you can keep people going and save loved ones for everybody.
Yeah, most definitely. So, in this generation, technology is only increasing. Would you say that you're quick to adapt those upgraded technologies?
Yes, definitely.
Okay, awesome. So whenever you're interacting with med reps like myself, do you value the relationships that are built upon those interactions? Or do you like strictly business, numbers?
A little bit of both. It's important to have a relationship with your reps so that way you can rely on them and call them in the event something happens with the product. But also it is a business, and so we want to take in those people's lives at stake. So.
Okay, awesome. And so whenever it comes down to making business decisions, is there anybody else that needs to be here in this room to have the final say, or are you that sole decision maker?
Sole decision maker.
Okay, perfect. So I want to ask you a few things before we get started. What would you say is the most challenging aspect of diagnosing images and things like that during your procedures?
Yeah, well, just the main thing is just having bad images, not knowing exactly where I need to go to take care of the procedure accurately. And once again, that's someone's life, and you don't want to accidentally be in the wrong spot. That could be major problems. And then just looking for something with multiple functions. That way I don't have to have a lot of machinery in the room. It just gets big and bulky, and having to learn multiple products and how they all have different functions. And then just something that's kind of eco-friendly, something with the material can be done with afterwards. It's not just going to landfill, this giant chunk of metal.
Okay, awesome. So you're looking for something that will reduce the amount of equipment that you have to use, multiple functions, things of that sort. Okay, and tell me, so what factors do you take into consideration when looking to take on new devices?
Availability of the rep to answer calls if we have questions, trainings, pricing is a big thing as well, so stuff like that.
Okay, great. So I noticed the probe you're currently using is a little bit outdated. Have you thought about upgrading that?
Yes, we're hoping to do that, but just haven't found the right product yet, so really hopeful today.
Perfect. Well, I'm super excited to be talking to you about this product. It is the L51K ultrasound probe.
Okay.
So this product is actually the smallest on the market. It's 3 millimeters short. So that way you can access hard to reach areas, unlike other probes that are out there.
Yeah.
And so this is just kind of an example of what you would be looking at with real-time images.
Yeah. Well, it's a lot better than what I have now.
Awesome. Okay, so we pride ourselves in accuracy, precision, control, and efficiency. So with accuracy, you're getting the most precise and clear images out there. So we have a frequency range from 15 to 3 megahertz.
Okay.
So the smaller frequency, you can see the larger images like diagnosing tumors, big things like that. And then if you're going to the larger frequency, then you can see teeny tiny little fragments and little tendons, things like that. So you'll be able to control that different option, whereas other probes you would have to unhook it, do another thing. So it's gonna really cut down your time with that. Is that something you feel like could be beneficial?
Definitely. The longer someone's under anesthesia, the higher risk they are, so we don't want that to happen.
Yeah, I mean, that's something that we were really looking for, is having something that is going to minimize the risk for patients. So this is something that's going to be super safe, easy to use, things like that. So precision, our probe is super precise. So as you can see here, it has a 360-degree movement. So that is something new. That is nothing like that is out there.
Yeah.
So you'll be able to look at all different angles, so super cool if
Mm-hmm.
looking at stuff like that. And then control, you'll have full control of this product literally at the touch of a finger. Instead of having to like have downtime to wait to have images processed and things like that, you're able to see it at the same time.
So it's like a live stream kind of thing almost?
Yes.
Okay.
Yes. So you'll be able to access things quicker.
Okay.
Also diagnose easier. That way it's super helpful for you and your patients.
Yeah,
And
definitely. Cool.
do you feel like that's something that you can benefit from?
No, definitely, having that accuracy and the control to like see things in real time, know exactly where we are, not having to wait on imaging, stuff like that, that is a huge time saver.
Yeah, definitely. So like I said, you don't have to switch out those different probes to have multiple functions. It has multiple uses. So that way it's super quick downtime,
Right.
kind of reducing all of that. So it's actually, it reduces the procedure time up to 75%, which is super great and innovative.
Wow.
Yeah. So
Gracious.
I wanted to kind of show you the economic value.
Okay.
We discussed the increase of efficiency,
Right.
so how fast it's going to be. You're also reducing costs because you're not needing to use the additional equipment like you would
Mhm.
for other probes. This cable is super flexible, so you won't need to use any other equipment, or sometimes you'll have to use extension cords, things like that.
Yeah.
All that is just out of the way.
Yeah.
Really minimal, that sort of
No,
thing.
that's awesome. Definitely takes up less space. Gives me more time to focus on other things as well, not worry about the equipment and making sure it's accurate.
Definitely, and since the procedure time will be cut down, you could take on more cases. I know you get super busy in the office, so
Yes.
it'll be super good. And I just wanted to show you kind of what else is out there in the market. So our biggest competitor is BK Medical.
Okay.
These are our different models, and that's the one that they have. They haven't upgraded it. This is just the same one that they've had for years. So you can see here, this product that I'm showing you is the smallest compared to these other ones.
Right.
That way you can, reach those hard to reach angles. It's able to go in like deeper than the other ones can get, because you see how large that is.
Yeah, no, that definitely looks like it'd be hard to see anything with it.
Yeah, exactly. Also, I'm not sure if you're familiar with Dr. Cotton. He's a renowned doctor in the area.
What an awesome dude, yeah.
So he had nothing but great things to say about it.
Cool.
So that's him. He left a positive review because, this is a new product, but he was able to, kind of be there for the early stages and test it out, and he had nothing but great things to say about it.
Oh, that's awesome, especially coming from him. He's very respected in this industry, so it's really good to hear that and know that someone else has been using it, and it just puts more confidence in myself to know that this is a great product.
Yeah. Also, with the whole training and setup, we have a full training and support team. So whenever if you move forward with our product, we'll have a bunch of reps that are training the doctors to make sure everyone is up to date with how it works and everything. We would set it up for you and everything. Also, whenever you're in your procedure, I'll be of attendance to make sure everything is running smooth. So it's super easy to use.
So how long does the training last, and how much does that cost?
So it's actually free of cost,
Okay.
which is something that we cover for you guys.
Okay.
The training would last 2 weeks.
Okay.
So that would be just to make sure everyone's up to date with it, because it is a complex product.
Yeah, I know for sure. So would we fly out somewhere to meet up, or to view the product, or would y'all come to us and teach us in-house?
So we have local reps to come in there, so we're not having to fly out or anything. We
Okay.
just drive down. We're gonna be there to set up everything and make sure it's good. Also, another thing that we offer is on my business card is a 24/7 support number to call. So if there is anything that you needed to address, there's someone to be there and talk to at any time or any moment.
Yeah. So I guess ultimately, how much is the cost of this product?
Okay, so right now for 2 units, it's going to be $3,000 each.
Okay.
So a total of $6,000. So just $6,000 you get 2 of the probes, and that's pretty much it.
Okay. And that you said comes with the training, basically.
Yes. So
Okay.
you don't have to pay for the training. That's on us, and just making sure that the doctors know everything we need to know.
Cool.
So is that something that you feel like could benefit you and your probes?
Yeah, definitely. seems like compared to the other, it's a lot more accessible and usable.
Definitely.
And the price seems very reasonable compared to other research I've seen, so.
Okay, would you like to move forward with this?
Yes, please.
Okay, well, here is the invoice. We're gonna take a look at that, and I can give you a pen if you want to sign.
Perfect.
There you go.
Actually, sign.
Yep.
Okay.
Well, thank you so much. I
Thank
appreciate
you.
your time. It was very nice to meet
Yeah,
you.
nice to meet you too.